Good afternoon, everyone, and thank you for the introduction earlier. I'm so excited to be here. So, I'll be talking about the community piece of the research. Healthy Baby Network, formerly known as the Perinatal Network of Monroe County, secured the PCORI grant to support this important work. And the organization began in 1996, and they are dedicated to ensuring that every parent in our community has the information and support that they need to bring a healthy baby into a nurturing home. And they offer many different programs to support the community. So some of these programs include health and perinatal education, doula support, including the only Black doula collaborative in Rochester, New York, as well as referrals and outreach. Healthy Baby Network also has several signature events to support better understanding and interventions in the community and to lift the voices of Black and Brown mothers, families, and communities. So Healthy Baby Network secured the PCORI Engagement Award funding for the 16-month project in 2019. So these funds were secured to help communities increase their ability to participate across all phases of patient-centered outcomes research. Excuse me. So the PCORI goals was to build a consortium comprising multiple stakeholders sectors in Monroe County. So the goal was to equip members to be effective contributors to PCOR, investigate local trends and factors contributing to maternal mortality and severe maternal morbidity, and explore interventions that might be tested and create a 5-year prioritized agenda. So the project objectives include to create and support a diverse consortium, identify local factors contributing to disparity in maternal mortality and severe maternal morbidity, achieve a consensus on what works now, what is ideal, and what is needed to achieve the ideal, and determine what research projects to pursue, set priorities for 5 years, and ensure the consortium's sustainability. So the approach that we took for this work is a community-based participatory research approach. And our work focused on building respectful interaction between our diverse group of collaborators. And time was spent learning about each other, our diverse perspectives, and how we can best collaborate to work on our goal. So how was the consortium built? So our work included multiple stakeholders, including Black mothers and fathers, community organizations, clinicians, and researchers. And we met monthly for about 18 months to work on the project. Um, and so my piece in this work is that I participated as a facilitator and as a mother at the table. And to be included in this work felt great because I was able to assist in doing research with people who look like me and that share some of the same experiences as me. Also, to know that my experiences uh, were used to drive some of the research that is being done. So as a participant, I was able to sit around the table and also share some of the experiences that I had as a mother and what were some of the things I went through during my pregnancy and during my labor. excuse me. Okay, so the specific purpose of the listening sessions was to actively listen to the lived experiences of Black women in the Rochester community. So I really wanted to highlight the piece about actively listening because I feel like that's very important in the work that we were doing with the moms, and with the moms, and also the work that was done with the fathers during the listening session piece. So when it comes to active listening, I like to think about building connections and building trust and making sure that you are paying attention, the eye contact piece, the safety and security, and making sure to not miss any of the critical information that is being shared. And so that is something that was very important during the listening sessions that we were doing with the participants. Um, Also, to acquire a better understanding of maternal issues from the perspective of Black women in the Rochester community in order to inform research, to learn about the lived experiences of Black mothers in the community, to utilize our active listening skills again, to ensure accurate collection of information, and to establish a welcoming environment that allows for uninhibited discussions. I do feel like in this space, we did a great job of creating a safe and secure space for our mothers. Um, and I think it really helped that the listeners and the facilitators and the scribes were also Black women. And so I felt like our participants felt really comfortable sitting in at a table with us, having conversations about their experiences with someone who looked like them. And I felt like that created a safe and secure space for them. So the listening session facilitator training, um, I really enjoyed my time at this training. I felt like it was very informative. It was exciting to be invited to be a part of the work. And it allowed me to understand more about some of the issues around maternal mortality. And it also prepared me to be a support to the women that I would be speaking with during our listening sessions. So, our listening session facilitator training included women, Black women who had given birth within the last 5 years. And the listening session facilitators were trained as part of, were trained to be a trainer, but then we also took part in the very first listening session as participants. So our stories were able to be included in the data that was received and to um, help drive the research that will be being done. And again, the listening sessions intentionally had only Black women as scribes and facilitators. So again, I feel like that really created a safe space for our women. And even after our questions were done and answered and we completed everything, we all still kind of hung around having conversations, and that just showed how comfortable the moms felt with the scribes and the facilitators that were at the table. So these are the three questions that we asked the participants. So what would you like to share with us today regarding your experiences during your pregnancy and delivery? What aspects of your interactions or experiences during your pregnancy went well? And what advice would you give medical staff to help them better address the various issues you may have faced? So these questions were very open-ended. So they were able to just share what they felt like sharing, what they were comfortable with. And as a facilitator, we were there to engage in the active listening, and we were able to kind of probe to get more information if, and the people were asked to share to their comfort level, so they were not forced to share anything they didn't want to share. But most of our participants were very open. They were very excited to be there, and they were excited to share their story. And it was a great experience a great experience for me. Um, and it was nice to see how many different directions these questions led us in. So each person answered it differently, and it all just kind of went in different directions, but we were able to gather quite a bit of information. Um, and I do believe that, like I said, having all Black women in the room really opened up the dialogue, um, for our participants to share more and to share openly and to go a little bit deeper. And it just really felt like a great space to be in. And the other thing I did want to share is that with our listening sessions, we did offer childcare, transportation, food, and a small stipend for the program. So that was a really big piece, um, because with mothers, you can assume that they're going to have their children with them. So to create a space where they are able to just relax and be able to engage in conversation was very important. So childcare was big, and then helping them with transportation. So if we think about the different barriers that moms can face when it comes to just getting to different things throughout the city or just wanting to participate in different programs, having resources to help break down those barriers. And then food was important. I think it felt like kind of like a dinner, like a family dinner. It was very laid back and very just very relaxed. So the other important piece is that we did a listening session with the dads, which served as both a great opportunity to hear the voices, and to echo some of what we learned from the moms. Um, and also listening to the experiences of the dads can it it you can the experiences of the fathers can impact the experiences of the mother. So if we think about a dad that's not feeling supported or just not feeling like their voice is being heard during the pregnancy or the labor stage, imagine how they may not be able to fully show up for the mom because of what they're going through. So I felt like it was important to hear the what their dad's experiences were as well. Um, and just to understand all the parts that can play, or all the parts that or all the pieces that play a part in the experiences of the mothers and how they can be impacted, also by the experiences of the dads. Overall, I feel like being at the table and being included in the consortium, was very important because as a Black mom and as someone who has given birth within the last 5 years, and being able to share my story, it just highlighted the importance of having not only content experts at the table, but also having context experts at the table to get a different view, to get a different input, and to from the really hear from the population which is being researched and to really get an understanding. And it feels good to just be a part of research that is being done on women that look like me and women that share some of the same experiences as myself. And so I will turn it over to Twyla.